Today, we're tackling a critical medical emergency, acute heart failure. Your response could save a life.
Imagine getting this call. It's an urgent plea for help. A patient is suffocating. Let's dive in.
So, what is acute heart failure? It's when the heart suddenly just can't pump enough blood.
And that leads to this, pulmonary edema. Basically, fluid rapidly floods the lungs. It's terrifying.
Okay, so how can you spot this crisis? The body sends out some pretty clear distress signals.
Look for these immediate red flags. The patient will be visibly distressed, panicked, and struggling to breathe.
But the single biggest clue is this. It's called orthopnea. Lying down is unbearable. They feel like they're suffocating.
Okay, let's move to the most important part. You see the signs. What do you do first?
This three-step response is absolutely crucial. And whatever you do, never, ever lay the patient flat. Why sit them up? This simple position uses gravity to help train the lungs. It brings instant relief. And furosemide, well, that's a powerful diuretic. It works fast to get all that excess fluid out. Now, your first aid is vital, but it's not the final step. They need to get to an ICU immediately. So now you know the signs and what to do. The question is, are you ready to act?